before we go any further, I'd just like to introduce the speakers. I'm Jo Wathen. I'm the UK Data Service Census team, and I'm based at Manchester. And north of the border is Fiona Cox from Calls Hub, who'll be talking about the longitudinal data. Right, so the headline for today is that the census collects information on a wide range of topics at the individual and household level. And by bringing together a lot of different characteristics, you can create powerful, flexible analyses in the same sort of way that you would do if you've got, say, survey data. The census microdata contain individual records that allow you to do this, but a common theme with all census microdata is that there has to be a good deal of care done in how that's about how that's done, because it's really important that census records are kept confidential. So what we'll be covering is where the data come from, what census microdata cross-sectional files are and how you might use them, how you might access them, and then what the longitudinal study files are, how they can be used and how you can access them. We're hoping that we're going to be talking for something in the region of half an hour, maybe a little bit longer, and that there'll be plenty of opportunities for questions at the end. Do type your questions. We won't be using mics. It just makes the whole thing easier to manage. But type them in as they occur to you, or we can I'll type them in at the end. Okay, so where the data come from, the thing that's in common with the census microdata, and at least the core of the longitudinal data, is that it comes from a census. And the census is one of those rare occasions where we actually count the population. We don't have population registration in this country, so it's not like we have an ongoing population count. And when we're doing that, we are counting people at a location so that we're able to do geographical analysis. We're also obtaining key characteristics about the population, and then those outputs from the census are produced possibly at small geographies, which is rather a unique feature. It's used for informing public spending, so things like the amount of money that local authorities get from the central coffers. And it's also used as the basis for identifying what the population is for a whole range of other statistical systems, for example, designing samples for surveys. Now, although I've talked as if there's just one census, in reality the census is conducted by 3 different organisations, and there are some subtle differences between them in the UK. So in England and Wales, the census is collected by the Office for National Statistics. In Scotland, it's conducted by the National Records for Scotland, and in Northern Ireland, it's NISRA, the Northern Ireland Statistics and Research Agency. And those agencies do an awful lot of coordination and collaboration and harmonise what they can, but there will also be differences between them to reflect the differences in those countries. In 2011, when the last census was collected, by and large, the data were collected by self-completion, post-out, post-back. And it was the first time that post-out and post-back had been done. But there was also an internet option that was taken by a good few people. And that meant that census offices could focus resources on areas that were hard to count, and therefore to maximise the count, which is absolutely essential. It's at the heart of doing a count. If you can't get a good count, then you've got a problem with your census. The sorts of topics that were asked count as being broad but wide. So although this list looks like quite a long list of topics, in reality not many questions were asked on any particular topic. So the things that were included were things like age, sex, country of birth, whether or not somebody was a short-term resident or not, and if so, whether they were planning on staying, their ethnicity, religion, what passports they hold, whether they speak English as a main language or what their main language is, national identity, household relationships, marital status, second residence, and migration. And then for households, they were asked about tenure, accommodation, cars, central heating, number of bedrooms, and a few other bits and bobs. And then for socioeconomic, you asked for health, unpaid care, qualifications, economic activity, occupation, industry, supervision, travel to work. Now, one thing that does jump out in all of that is that the income was not asked. Income has been a hot topic. It's really important for social policy. It's really important for identifying where resources are needed. but in the UK it so far hasn't been possible to ask an income question as part of the census. It's been tested, but when it has been tested, by and large, response rates have fallen in the versions of the test that include that question. And going back to what I said about the importance of having a population count, any question that results in a reduction in the response rate is bad news. So it hasn't been able to go through yet. It's on the wish list for 2021 though, although it might not be in the form. Now, when a census is conducted, a promise of confidentiality is made to respondents. Now, that's quite important, partly because of the need to get a good count, so there needs to be trust that people's data is going to be looked after. And partly because it's compulsory. So if people don't respond to the census, then they can be fined. So the idea that you've got something that's compulsory and which people might not want to give up information on means that you have to be really careful about what's done with that information. So this promise of confidentiality is taken very seriously. If you ever visit one of the census offices, you'll realise quite how seriously it's taken. Security is high, and it's important. But what I've got on this slide here is the promise that was put onto the information that went out with the census for England and Wales last time round. So it says that the confidentiality of personal information is a top priority, and that your personal information is not shared with other government departments, local councils or marketing companies. It's only going to be used to produce statistics and for statistical research, and that these statistics will not reveal personal information. The census records with the identifying information are kept for 100 years. So that has some implications then for what we can do with the data. So before we get into what data are available, I'm going to ask you another poll. So if you're ready for this, which is, what might this mean for users of census data? So I'm going to launch another poll right now. Okay, hopefully you can see the results then. So we've got 63% say that the ability to link census data to other data might be limited. That's definitely true. So if what you're hoping to do with census microdata is to be able to take individual level information and link it to individual information yourself, chances are you're not going to be successful with that. I'm sure Fiona will talk about ways in which the census units have been able to do linkage, but it's in a very limited way, and it's not something that you can expect to do yourself, although you might be able to add geography to geography. Working back up, the law may put limits on who can access the data. That's true. So you'll find that if you've got really detailed data, so detailed that it could potentially be disclosive, then there may be a way through for what's called an approved researcher, but not for somebody just off the street or somebody who's just doing a student project for an undergraduate dissertation, for example. So there may be legal restrictions on who can access the data. The amount of detail that's on outputs is also limited. So as you'll see as we're discussing the microdata today, the amount of information that can be on any output will vary according to how accessible it is and whether or not it's on the right side of that limit where you have to be an approved researcher. But if you've got data that's not for approved researcher, if you've got more geography, you'll have less socioeconomic detail, for example. And we'll see that when I talk about the sorts of data that are available through the census microdata. The first one, though, no outputs can be made available for 100 years. That's thankfully not the case. Although promises are made that personal information won't be made available publicly for 100 years, which is very much the case. So you'll find that as we come towards 2021, 1921 data will be available for people who are interested in family history, for example. But outputs can be made available as long as they're not disclosive. So we'll see that there are census outputs that are available within a year, couple of years of the census being conducted, and those are available now for you to use, thankfully. But not outputs, public outputs cannot be ones which contain non-disclosive personal information for 100 years. Okay, so the sorts of outputs that are available then. I work for the Census service in the UK Data Service, so I'm bound to talk about this in terms of what we've got available. Are the microdata, which we're talking about today. So they're samples of census records. So you've got individual records. The detail is limited on those records to protect confidentiality, but we've only got samples. So if you find somebody who you think looks a bit like you or a parent or something, actually, if it's a 5% sample, there could be 20 other people who look like that. And there's a degree of uncertainty about who's in that file. The census area statistics are counts for areas of combinations of characteristics. So they're known as aggregate data, or in the past tabular data. So they typically come in big tables of counts for areas. We're not talking about those today, but it's good to know that they exist and that they work quite well alongside the microdata. So if you're interested in looking at areas and maybe matching areas, information about areas onto microdata, it's not a bad way to go, or supplementing information about areas with stuff from microdata. Then there's flow data, which counts migrants or people's place of work versus their migrants from where they used to live to where they're living now, or between first and second addresses, or between place of home and place of work or place of study in Scotland. So they're particular tables that just count those combinations of geographies so that you can see, say, patterns of migration over time. And then the last thing that's available is shape files. So files of boundaries that allow you to map these outputs according to their geographies. On top of that are the longitudinal studies, which are supported by calls, which Fiona's going to be talking about. So for those of you who aren't familiar with the microdata at all, then we need to first of all get into our heads what we mean by that. So this is not a data set. This is a corner of a data set. In fact, it's a corner of the least detailed of the Census microdata sets. It's the teaching file for England and Wales for 2011. And what we see here then is, instead of tables which contain counts, we have tables which contain information about particular characteristics or variables for individual respondents. So this person here is aged 55 to I think 64. Their social grade is D or E, so that's working class. They're born in the UK. I've truncated that so I can't actually see what that is. Their ethnic group is white. They're married, they're in good health, they work in mining, and so forth. You've got that level of information for everybody, which gives you an awful lot of flexibility. But unlike the aggregate data, which is for populations and it gives counts full stop for 100% as long as it's been coded up for 100%, here we've only got the data for a sample. So in the case of this particular file, it's a sample of 1% of the cases. We use this type of data because it's very flexible. So if you are in the situation that I was when I started out with census data, where I wanted census outputs with A by B and B by C, and when I made the request for those data, somebody said, well, actually, unfortunately, those tables don't exist. Microdata is your answer, because as long as it was collected by the census, you can create your own tables. Similarly, if you want to combine characteristics to create new ones, so derive your own variables, you can do that. You can define your own subpopulations, and you can undertake multivariate analysis at the individual level. So it's great for things like avoiding the ecological fallacy. And the bonus is that it can be used alongside count data. So if you were trying to decide whether or not you wanted to request a custom table, you could use microdata to plan that. If you've got area level characteristics, you might want to add to that by using the microdata, or you might want to use area levels with area level characteristics, or you might want to take the microdata and then add in some contextual geography from the aggregate data. But because it's sample data, it means that any results will be estimates. And if you drill down a long way so that you're working with small groups, those estimates may encounter problems with standard errors, and you might have to think about things like confidence intervals in the same way that you would if you were conducting an analysis of a survey. But quite often the sample sizes are huge, and although there's sample error in there, it's not going to be a problem. Also, by and large, because we have a lot of different variables on socioeconomic characteristics, we tend to have very limited geography. Now, if you have lots of geography and you have lots of socioeconomic detail, then you're not going to be able to get that easily. So instead, we have, for 2011, a teaching file that has got limited geography, it's got limited socioeconomic detail, but you can get hold of it without any licensing at all. If a file that's got grouped local authority or regional area but with a decent amount of socioeconomic detail, that is still available, but you have to go through licensing first. Controlled data or secure data has lots of geography, so you have true local authority, which is as much detail as you get on these pre-prepared data sets, and lots of socioeconomic detail, so things like individual country of birth, individual year of age, right up to top ages. But that is in a controlled setting, and you're not going to be able to download that. You have to be an approved researcher to use it. So, the 2011 data were released separately by each census office, so we've got England and Wales, Scotland, Northern Ireland separately. We have a 1% teaching file. We have two 5% files at the safeguarded level, so one which has got region in and slightly more information on socioeconomic characteristics, and one which has got grouped local authorities. So any local authority that's got 120,000 people can stand on its own, otherwise it will be merged with a neighbour, and that's another 5% file. Slightly less socioeconomic detail to trade off against the extra geography. And then the controlled access files. There's one which is an individual sample, and then there's one which groups household members together and takes the whole household as the sampling unit, and each of those are 10% files, so they're pretty big. I've put England and Wales, but also available in Scotland and Northern Ireland as well. What does that mean in terms of the sorts of detail that's in it then? So the teaching file, which is a regional file, has no licensing, a 1% sample, only has 8 age groups in it. Occupation, there's 9 groups, and ethnicity, there's only 5 groups. By the time you get to the safeguarded files, then you'll find that the sampling size has gone up. Occupation is at 25 groups, ethnic group is up to either 18 for this regional file or 13 for the local authority grouped file. By the time you get to the secure data, occupational detail, you have 369, the individual units of standard occupational classification, and for ethnicity you have 151 categories. So you can see how much more detailed secure data are than the teaching data, but you should always use the lowest level of detail that you can get hold of, that will do the job for you. And certainly you shouldn't be accessing the secure data if these other files will do what you need them to do. Okay, little bit about the local authority grouped file. So as I say, the local authority grouped file won't identify every single local authority, but it identifies local authorities that reach this 120,000 population threshold. So that means, for example, if you're looking at London, as this bit down here is, you won't see the City of London identified because the City of London is too small, instead of which it's merged with its neighbour Westminster. So that's an example. But we have got fairly good geography, as you can see in the little corner here. You can see how many local authorities we've got identified there. And even where we've got large local authorities like Cornwall, which are a single unitary authority now, there's a little bit of breakdown in that. So it's as comparable as it can be with geographies that were available in 1991. Doing this, you can create your own grouped local authority estimates of characteristics, and you can map them as we have done on this chloroplet here. So the example here is one that you wouldn't be able to find in the aggregate data, which is people who've lived in Britain since 2000, at least since 2006, and who don't speak English well, according to them. So it's actually quite a rare characteristic. Overall in the population, there's only about 1% of people who fit into that category, so it's quite an unusual thing. But looking at the map here, you can see that the vast majority of the country are in the lowest possible category, so only a fraction of 1% are in that category of having lived here at least since 2006 and not speaking English well. And when you look at the hotspots, there's only really 2 hotspots in the whole of the country, and those are Newham and Leicester, unsurprisingly, and they stand out a bit like a sore thumb, really. But it's the sort of thing that you can do with the data. So what I did was I took account of all the people in that particular group, and then I worked out what percentage it was for and then I matched it on to boundary data that I accessed from the boundary service within Census. And we've got boundaries that have been made specifically for using with this data. So you can download those, you can create your own maps. Another thing to watch out for with microdata is that in all of the microdata there's been some flexibility about the populations that you use. So if you are looking at a table that's been produced, it will be for a specific population. In the last few censuses, it's been typically for usual residents. In the census microdata, there's always been a little bit of flexibility. In 2011, the flexibility comes around whether or not you include or exclude short-term residents. So that's people who've been living here for between 3 and 12 months, and students. So students are counted at their term time address, but they're also a little, just something like 6 questions are asked about students at their holiday address if it's separate. That means that students could potentially be double counted unless you decide whether or not where you're going to include them. So something to watch out for when you're doing the analysis is that you're going to need to decide what your population base is. There's a variable that will allow you to filter your data so that you're only using the population base that you want to use. Just briefly, a few bits about some of the sorts of research that's being done. This research here, there's some research that's going on in Bristol, which is around kinship carers. So a kinship carer, then, they're defining as people who are looking after, raising children who are members of their family but who are not their direct children. So it's a family where you've got kids being raised by family members who aren't their parents. It's actually quite a rare phenomenon. It's something like 1.4% of children are in that situation. So this piece of research is able to take advantage of the fact that the sample sizes are really large to allow them to get a decent sized sample of people who are in that situation. Now, there's no formal question on kinship caring in the census, but the team were able to use the secure data, which contains samples of households that are connected together, to be able to look at the relationships between individuals and their characteristics to identify those kinship carers. There's also been a fair amount of work done about unpaid care. There was one question about unpaid care in the census, which was about how much unpaid care do you do. Paul Norman and Kingsley Purdom, Manchester and Leeds, looked into this and were able to identify, for example, that unpaid care is particularly common amongst those who are aged in their 50s, and is more common amongst people from Pakistani or other South Asian groups. Because they've got the full set of variables, they're able to create some statistical models, and they found that once you included socioeconomic characteristics, that you still had this clear effect of being a South Asian, sort of Pakistani or Bangladeshi or other groups, excluding Indian, in terms of being more likely to provide up to 20 hours of caring. But once you controlled for those socioeconomic features, you didn't see so much of a strong effect for ethnic effect for those who are providing more than 20 hours of unpaid care. Lisa Buckner and also Susan Yandel at Leeds, they've also done a heck of a lot of work on carers and carers' disadvantage using census microdata. And some of that has been really quite influential in policy circles and has been cited as one of the reasons that that some tax breaks were given to carers. So they've been able to identify the economic disadvantage that carers experience. Carers are more likely to be older, likely to have poorer qualifications, less likely to be working. Okay, so that's all I want to say about the data because time's getting on. But you'll find information about the microdata on the UK Data Service. The open data are available in spreadsheet form from the census offices, but you can also get SPSS Stata or Nestar formats from the UK Data Service without registration. The safeguarded data for 91, 2001, 2011 are all available through the UK Data Service, and you need to undertake an online registration process for that. Quite painless. Do need to be UK based though. The control data, you need to contact the census offices because they're the ones who are in control of that. To find the data from the UK Data Service, probably best way is just to type census microdata in. Census microdata is the formal name of these data for 2011. Before that, they were known as the samples of anonymised records. So you might want to type samples of anonymised records if you're interested in 2000 or 1991. Also on the website you'll find a census microdata page which has got a bit of a guide to census microdata, and we'll have some updates about what's going on, lots of useful links. Before I pass over to Fiona then, with apologies for having gone on a bit, a few things you might be interested in. If you're interested in older data, you might be interested in the ICEM, which is integrated census microdata for pretty much the Victorian period. There are international microdata samples available from 79 countries. You'll find those at IPUMS. And fingers crossed, we've got permissions for 2 of these now, and I'm just finishing off documentation for 61 and 81. We should have some samples of anonymised records for 61, 81, and hopefully soon 1971 as well. If you want to know more about the sorts of research that's going on and also what's happening with the planning of the next census, I need to give a heads up for the Census Research Conference on the 22nd of June. It's free to attend. It's in London. You're going to see a mixture of talks from the data collectors about how the plans are going for 2021, because they're well advanced and they're already testing. And you can user presentations that include presentations about census microdata and longitudinal data. So you can find a link to the booking for that off the UK Data Service website.
My name's Fiona Cox. Sorry, I'm just sharing my screen here. Hopefully that's me now. Okay. I'm based at St Andrews University, and I'm going to tell you a little bit about the census-based longitudinal studies. I'm the project manager at Calls Hub, and I'll tell you a little bit more about what we do. So in the UK, similar to the different censuses, we have the Scottish Longitudinal Study, which is maintained and supported by the SLS Development Support Unit. We have the Northern Ireland Longitudinal Study, the NILS, which is maintained by NISRA and supported by NILS Research Support Unit. And for England and Wales, we have the ONSLS, which is probably the most well-known, and that's maintained by ONS and supported by Celsius. And Calls Hub has been created just to kind of bring these together, support them and promote them to the wider research community. So a little bit more detail about the studies. The 3 each have different a different sample size. So for England and Wales, the ONS has a 1% population, Scotland has 5%, Northern Ireland has 28%. And in case you're wondering, the sample is based on top secret birth dates. That's how we select people to be included in the LSs. So you can see here at 2011 the sort of sample size we got, although the actual membership of the LSs is much bigger. The ONS has just over 1 million members now. Included in the studies, the ONS is the longest study, which goes right back to 1971. So they have up to just over 40 years of follow-up, which is fantastic if you're looking to research over the life course. The SLS and NILS focus on the 91 to 2011 censuses, although the NILS does actually have some data for 1981 as well. As I've mentioned, academic support for academic researchers is given by Celsius, SLS DSU and NILS RSU. If you're a non-academic researcher wanting to use the ONSLS, you would be supported by the ONS team rather than Celsius. So, which of the following types of data do you think can be found in the census-based longitudinal studies? I know that only one of you has actually used the LSs, but if you just want to give it a try. In fact, all of these are available apart from date of birth, because that's too sensitive, and as I mentioned, we select members based on date of birth, so we'd identify individuals if we release a date of birth. So unfortunately, date of birth is not available. We can use month of birth and year of birth in certain circumstances, but not the actual date. Housing tenure we have from the census. Number of cars in the household we have from the census as well, and we actually have antidepressant prescribing in Scotland and in Northern Ireland from NHS records, which can be linked into the census data, and I'll tell you a bit more about that in a second. Unfortunately, we don't have income from pensions. That was a bit of a trick question there. So, as Joe's already said, the census data contains a range of information about socioeconomic, family relationships, health, education, religious beliefs, ethnicity, etc., etc. And the three LSs have complete census data for all study members and also for people living in the same household as the study member, which can give you some context, which is very useful. For example, looking at parents of children or how many children are in the household and their situation. In addition to the census data, the ONS has births, deaths, widowhoods, some immigration and emigration in and out of England and Wales, and cancer registration data. You'll see that the SLS and NILS actually link to slightly more data, external data sets, but that's something that's being explored with the ONS at the moment. And in fact, there's a project underway to investigate whether information can be brought in from open street maps on, for example, waterways, a green space, and transport facilities. So that looks like a promising avenue there. The SLS has quite a few more linkages. We have marriages as well as births and deaths and widowhoods. We have education data, including attendance, exclusions, attainment, qualifications. We also, which is not listed here, have criminal justice data that will be linked in very soon, and ecological data on weather and pollution, which can be linked at the grid reference level to give very detailed information. On a project-by-project basis, the SLS can also be linked to the extensive NHS Scotland data, which covers everything from hospital episodes, maternity data, cancer data, prescribing, all sorts of things. So that's a really, really valuable, and the SLS does get used for a lot of health-related research. The Northern Ireland longitudinal study also has a lot of linkages. The NILS is actually based on health registration rather than census as its core. So it actually does have even more health data contained in it. So for example, they have GP data and dental data. They also have land and property services data. And for all three LSs, I should also say that you may also be able to link in your own data at the geographical level. So for example, if you have information on pollution or weather or transport for a certain area, that can be linked into your LS data set, subject to discussing that with your support officer. Okay, so the lowest geographies allowed in the LSs for outputs vary slightly for the three LSs. For Scotland, it's the output area, which is very small. That's 20 to 77 households, a minimum of 50 people. In Northern Ireland, it's a super output area. And in England and Wales, because of the smaller sampling ratio of 1%, it's county district level or ward groupings to equivalent size. Now, the staff supporting you at the RSUs are able to use smaller levels, right down to grid references. That's used for linking another data set or for creating derived variables that are then at the bigger area for you to be able to use. So longitudinal analysis, as compared to the SARS and the snapshots data, it adds the dimension of time to the analysis. So this allows you to examine, for example, the effect of policy changes, of personal situation changes, or changes in the environment in the neighbourhood. And it allows you better to establish causality because you have time 1 and time 2, so you know which comes first. So, for example, some of the classic effects that are looked at in longitudinal analysis are age effects, comparisons of the same group over time, period comparisons, which are comparisons of the period in time as opposed to the individuals, or cohort effects, which are comparisons between cohorts over time. And the longitudinal data allows you to pick out all these different things. So in terms of uses of the LSs, I recently did a citation analysis covering LS journal papers from 2010 to 2016. You can find more about that on our website. And you can see here the really wide range of topics that the data are used for, everything from nursing, dentistry, agriculture, business, economics. Again, the biggest two topics for journals were social sciences and medicine. But as you can see, the data can be used in a really wide variety of ways. Some examples of impact. The ONSLS is used regularly by the Department of Work and Pensions. And it's also made important contributions to policy. For example, the Dilnot Commission and the Marmot Review both drew on the ONS for evidence. Some examples from the others, in the SLS, some research on changes in the demographic patterns of tenure type informed housing policy changes in Glasgow. And in NILS, research on patterns on the uptake of breast cancer screening informed the subsequent public health strategy. So the LS Kits research appears in books, book chapters, journal papers in some very highly ranked journals. This is just some quick examples for you. You can explore these on our website. To access the data then, the LSs are free to use. Researchers are welcome from academia, including research students, government policy groups, third sector organisations, research from other organisations, or if you're overseas, you should get in touch with CALS or the RSUs to discuss arrangements and whether it would be possible to access it. Because of the sensitive nature of the data, the LSs can only be accessed within designated safe settings. So in Scotland, that's in Edinburgh, the NILS is based in Belfast, and the ONSLS is accessed at the VMLs in London, Titchfield and Newport. And researchers are required to complete an application process and to undergo training before they access the LSs, and they also have to show that they are either experienced in using longitudinal data or they have access to someone who can help them if they're less experienced, for example, a research student. Information on all the steps involved are available in the Guides and Resources section of our website, so do have a look there. Just to mention a few developments that we've had recently. The three LSs have to be held separately for legal reasons, so that means previously you weren't allowed to combine them to get a UK-wide or a comparative analysis. But now eData Shield, this is a methodology that's been developed at SLS DSU, allows you to use more than one of the LSs and to combine them in a regression or a survival analysis model as if they were in the same data set, which is fantastic, and it's a really powerful thing to do. We've also been developing some synthetic data, so currently you can download a synthetic core version of the ONSLS, and I think the SLS one will be going up soon. And that's just to have a look around longitudinal data. It can be used for teaching, just to get a feel for what the data looks like. And for the SLS, and hopefully soon for the other two, if you have a project approved, you may be able to get a synthetic version, and that means instead of having to go into the safe setting to develop your syntax and models, you can work on your synthetic version at your own desk, which is fantastic. It's important to note though that the synthetic data, it's not real data, it looks like data and behaves like it, but you have to do your final models on the real data. And one other thing I didn't put on here is the SLS have recently added in a 1936 cohort, which brings people right back, data right back from 1936 and 42, and there's more information about that on the SLS website. So more information is available on our website. We have a data dictionary that covers all 3 LSs. You can explore frequencies for some of the variables. We have similarity scores, which allow you to compare variables between the 3 LSs if you want to do some e-data shield and some comparisons. And you can also save a list of variables to come back to it later, or you can download it for your application. We have an outputs database that you can fully search, which has all things from working papers and briefs and books and conference papers, news, blog. We have summaries and briefs that are just sort of a shorter, quicker way to access the outputs. And a more recent thing, we have thematic guides and webinars that go with them. So at the moment we have our first one up, which is about using the longitudinal studies for research on health. So these are just sort of focused on a particular topic, giving examples and some information that you need to know if you're thinking of using them. So that was just a very quick tour. So do get in touch if you want more information. You can find us on our website, on Twitter, or by email. Thank you very much.